Hello, everyone. So today's talk is going to be about how to navigate the cytokine storm. And so, how does an integrative health center help others to understand the immune response, understand inflammation, these words like cytokine storm? So we are thankful for the questions, for being there. Keep asking us questions. We're getting a lot of questions about what is a virus? What is the immune system? And other questions that we're happy to help. We see the statistics are about 80% are asymptomatic. You don't have to go to the hospital. Again, the CDC has guidelines on symptoms that require hospitalization. It's very important that you familiarize yourself with those symptoms. But it's so important to know that 80% don't have to get hospitalized. And with the overwhelming amount that the hospitals are getting now, and the overburden of the nurses and the lack of necessary equipment, it's important for practitioners like myself who have integrative health centers or functional medicine clinics to be out there helping people stay out of the hospital by supporting their immune system and making sure all their health factors are taken care of. We see that this virus has a sneaky way of getting into our cell. It uses this ACE2 enzyme. That enzyme is a part of this system in our body. It's known as the renin-angiotensin-aldosterone system. That system is involved with our kidneys and our heart and our lungs, and that's really responsible for our blood pressure, and it's responsible for our hypertension, our heart, our contraction and relaxation of our blood vessels. And that is why people with cardiac issues, hypertension, kidney issues are more susceptible. But why are diabetics so susceptible? Why are now we're finding out that it's not just if you have a diagnosis of diabetes, but it could be possibly that you have this metabolic syndrome. You just are obese, central adiposity, the inflammatory fat, meaning that when there is this layer of fat, not just subcutaneous where you can pinch an inch, but it's that layer around the organs, that visceral fat that we know is inflammatory. It means it puts out these messengers that create inflammation. And so these are risk factors that many of us might be unaware of. So we want to get our blood pressure under control. We want to make sure our sugars are balanced, and all these other kind of risk factors are taken care of. And that's where we as practitioners can help others today. Now, again, with social distancing, it takes a little ingenuity of a clinic. So, for example, what we're doing is we work with a nurse, a phlebotomist, who very cautiously and carefully goes to people's homes. We know that it's more rare to catch this virus outdoors. So if this phlebotomist can safely, washing up properly and wearing a mask, can do the blood draw outside on a balcony, on the porch, in a garage, it's much safer. We're able to get a blood draw. We're able to look for markers of inflammation, of immune compromise, and other important factors. Again, hypercholesterol, more cholesterol in the blood, and other lab factors that we test for and that other integrative practitioners test for that will reveal to us levels of inflammation. It was over 20 years ago that myself, I've been involved with the immune system inflammation while dealing with HIV/AIDS. At that time, I knew we could help with lifestyle, diet, certain immune building supplements, and we were very successful at helping people maintain their health. And that was the introduction I had with the immune system. And we've learned so much. And we continue to learn, just like the message of cytokine storm What is that storm of chemical messengers? Is it really a storm, or is it dysfunction? And so that is an important discussion today. Hello everyone, and thank you for joining. Again, we are so glad to be here as an integrative center. Again, we're practicing social distancing. The center is closed. There are nurses, other healthcare practitioners who are there on the front line. We're going to be there for them. If they need vitamins or supplements, they're going to be first on the list, and we do curbside pickup with a mask and gloves to get them their vitamin C, their vitamin A. This is only supportive, just so they have their basics. We're not looking for mega doses or for these miracle type of cures where we're going to take high doses of vitamins or certain nutrients that we hear about. Again, we want to be evidence-based, science-based about everything that we do. And that's why we're discussing today how to navigate this cytokine storm. So our immune system is so intricate, and that's why really it's not to be afraid of this storm. It's not actually the storm that is causing this destruction and ultimately a high risk of death once a person goes into that major cytokine storm. It's the destruction from the storm. And therefore, if we have the chemicals and molecules that wipe up, that clean up, resolvins they are called, then we can, and glutathione is a big part of that. Antioxidants are a big part of cleaning up after that storm, because this storm makes what's called reactive oxygen species, these oxidants, which at some point in this process is so important. Don't forget, all of this is part of our natural process in our body. These cytokines play a very important role. We have this immediate reaction from our immune system, but this virus is sneaky. It has a way of getting into the cell and it avoids our first line of defense, which is interferon, which is produced by our macrophages. Macrophage, a large cell that eats invaders. And in this case, this virus is sneaky and it gets by that first line of defense, and until slightly later in this disease process, that's when these macrophages, they bring on this major response and they secrete their chemicals, which in some cases are hydrogen peroxide, something very similar to bleach, very powerful chemicals to destroy these viruses. And that in turn brings on more messengers, chemical messengers, to create more inflammation, and eventually they go into this revolving cycle that then leads to a cytokine storm. We do see in the research that the excess interleukin-6, now that again, that's a chemical messenger that will be produced by some of our, part of our immune system. When we see high levels of interleukin-6 in the blood, we know that a person is more at risk for being put on a ventilator, being intubated. So that's a marker that we're quite familiar with in integrative medicine, because we deal a lot with autoimmunity, and we're looking at that marker interleukin-6 as far as what's creating that. We see that's a part of our lymphocytes. The lymphocytes are that second line of defense, the line that has memory, the line that we're hoping for when we get this virus, we're going to have a memory of it, so we'll be immune the next time. Those are our T cells, and they create these other cells called CD4, CD8. They're our helper cells or natural killer cells. We see that in the blood work of COVID-19 patients, the lymphocytes are low, the neutrophils are elevated. So the cytokine storm is not just everything is ravaging and everything's elevated. No, we have low lymphocytes. These very important helper cells and natural killer cells are actually low. So that's why when we hear these rumors of elderberry, which the research article was back in 2002, and it was on directly putting elderberry on a macrophage. And they saw that it did release these cytokines, including interleukin-6. But so many studies were done afterwards with elderberry that we see when it's actually within a person, within a live body, interleukin 6 goes down, TNF alpha, another chemical messenger, is down, and it actually is improving these lymphocytes. It's all that we want with elderberry, as opposed to reading one article. And again, that was about a month ago when we didn't know as much about this cytokine storm. Now we know the lymphocytes are low and the neutrophils are high, and the macrophages are elevated also. So, hi everybody, I'm glad you're joining today. Again, we're glad to be of help, and how we're doing that is we have a mobile nurse phlebotomist safely drawing blood so we can get these markers of inflammation. We've been doing that ever since, well, again, I've mentioned I've been studying the immune system and working with autoimmune patients and patients with HIV, and the immune system was a big part of what I am doing, and therefore a lot of the blood work that we do is finding out where inflammation is coming from. For example, even doing a ferritin level, that's our storage form of iron, but when it's elevated, it's a sign of inflammation, and we see that with our COVID patients in the hospital. Elevated ferritin, elevated D-dimers, elevated high sensitivity C-reactive protein, which we measure. Now in the outpatient, in the setting that we're in the integrative center, our high sensitivity C-reactive protein, a marker for of inflammation, we have a lower cutoff because we're much more sensitive. Where is inflammation coming from? Is it from heavy metals? Is it from environmental toxins, cosmetics, plastics, water that is not purified? So we're getting a lot of chemicals. Is it from the die-off of bacteria because we have an overgrowth because of many of the lifestyle things that we're doing? That we have an overgrowth of bacteria, and our gut, the cells in the junctions of the gut are not as tight, meaning that there's what's called leaky gut, or a permeable epithelial junctions, allowing proteins and particles to get through, and therefore our immune system, again, the immune system is activated. It's creating antibodies to foods. That's why we do a very advanced food sensitivity test that's based on inflammation. Because if we only did a food sensitivity test based on immune markers, meaning immunoglobulins like IgG, which is an immunoglobulin that is a marker of the immune response that's been going on for a while, then we're going to always get a lot of foods because our body's reacting to a lot of foods. Surprisingly, we eat foods that we're reacting to. We seem to crave the same food that we are reacting to. This particular food sensitivity test goes a step further. It's measuring a complement, meaning that down the line of the immune system, eventually it's going to activate inflammation like we see with this virus. Our immune system is activated. It can't find the virus. It's going to send out messengers. It's going to activate inflammation. Same with the foods we're eating. So we want a food sensitivity test that measures inflammation. Again, that's going to be important to remove those foods so we can lower levels of inflammation. When we do a certain test that is a stool test, because so much of our inflammation and immune system is coming from our gut, 60%. There's a marker called calprotectin. That is a measure of inflammation in the gut. And then the IgA, secretory IgA, is measured. That's a level of our immune system that's reacting to toxins, to foods. And when it's low, that might be because we've been reacting for so long. But when it's high, then we're overreacting. Again, it's a balance in our immune system. So when we hear cytokine storm, we should realize that's not the proper, although it is right that there's a storm, there's all these messengers being created. But what's really important is the balance of the immune system, and that at one point, all those markers in this cytokine storm are important because it's going after the virus. It's creating these chemicals that are going to kill viruses. But when they go on too long, they create destruction. That's why we need to be sweeping these up with very important antioxidants. Some of my favorites are from pomegranate. That's a very powerful antioxidant. Resveratrol from grapeseed, from the seeds of grapes, and other very powerful antioxidants will wipe up these inflammatory they die off, or they die off from these reactive oxygen species, oxidation. So important that you balance your fats. Omega-3 is extremely important to resolve in, to clean up these damaged reactive oxygen species, but also to control inflammation. How do you balance omega-3 versus omega-6? First of all, it's important to cut out as much vegetable oil from your diet as possible and increase good fats coming from flax seeds. Hemp seed and chia seeds has some omega-3, but they have omega-6. So when we want to be cutting down on inflammation, we really want to be balanced with a 1-to-1 ratio of omega-6 to omega-3. So omega-3 is in fish or sardines and other very important foods. Again, it's so important from what we're eating, what the animal is eating also. So we find that an animal that is grass-fed, the makeup of the meat that we eat is going to be omega-3, not omega-6. The omega-6 comes from an animal that's fed soy or corn. That is very important to know next time that you go out and purchase meat. Is it grass-fed? That's going to give you those omega-3s. So that is the immune system. And so we have these tests. So how does the integrative center work at this time when this clinic has to be closed, but people want to know, how do I improve my immune system? How do I make sure that these levels of inflammation are controlled? So that's when we send the kits directly to your home, and you send the kits back to the laboratory. We get the results back, and we work on controlling inflammation. If the gut is what's causing this inflammation, we're going to work on that. I can give the recommendations. And if it's foods, of course, we're going to eliminate those foods. Vitamins are also very important. I know there's a lot of questions I get on that. It's just so important to be taking the right forms. I've given previous Facebook Lives. Everyone is always free to call. The ones who are now watching this Facebook Live, and I'm happy that you're here, know that when they reach out, we respond back and answer their questions. But again, we can have a phlebotomist come to your home. We would do blood tests in a certain way that we will be knowing if there's inflammation, high sensitivity reactive protein, homocysteine, ferritin, even uric acid, if it's elevated, tells us about inflammation. Even a marker called sex hormone binding globulin, if that is elevated, we can suspect that there's a level of inflammation in the body. Then we can dig deeper. Then we can send out these kits. If you want to do even a type of test, which is a heavy metal test, a simple urine test would tell us if there's elevated metals. And it's very important to know that. And those kind of kits can be mailed to your home. One more thing that's very important. Testing is so crucial when it comes to COVID-19. We knew that from months or over a month ago. But the tests are slow, they're expensive. The most common test is a type of real-time PCR, nucleic acid test. Expensive, and we're getting them out there. A culture is very expensive. The type of lab that needs to do it is extremely expensive to have. So we're offering at our Integrative Health Center an antibody test. It's the one that they used in Wuhan, China. It's been done on thousands of people. That test can be mailed to you overnight. It takes about 48 hours to get a result. It's going to measure IgM and IgG antibodies. IgM are the first antibodies to come on after a person is exposed to a bacteria, a virus. That's IgM. IgG takes some time, approximately 2 weeks, maybe a little longer, for those antibodies to appear. So there are very accurate tests that can measure IgM and IgG. And why is that important? That way a person can know if they're a carrier. There's so many people, 80%, that are not symptomatic, and they've been exposed to COVID. They've been exposed to the virus. So it's important to know that. That way you can be extra cautious around immunocompromised elderly. And you can know also, you could feel a little bit more at ease knowing that you have antibodies. This test is 100% specific. And that's very important, because 100% specificity is very important when you want to rule something in. And that means when it's positive, it's positive. That's very important to understand that. So again, we're going to handle this as best that we can. So please give us a call. And any of these tests can be mailed out to you. We do have that mobile nurse, again, to do the blood draw in case we want to do blood markers. Again, while this is going on, we still need to know if we have elevation, if we have risk factors. Homocysteine is a risk factor for vascular inflammation. In other words, if the inner lining of our arteries or veins are going to be inflamed, that is a measure that we can tell by homocysteine. And these are going to be blood tests. That's why a blood draw sometimes is very important. It's going to tell us a CBC, a complete blood count, how your white blood cell, how your lymphocytes. We will measure CD4, CD8 to see the T cell balance, your helper cells and your natural killer cells. We're going to measure high sensitivity C-reactive protein and fibrinogen to see levels of inflammation. If that's not possible, then we'll do the stool test. So we'll know if there's inflammation or a buildup of bacteria, or if the immune system in the gut is deficient. We'll do a food sensitivity test, so we'll know if there's levels of inflammation coming from the foods that we're eating. We can do vitamins that are tested, very important. Again, we can test vitamins from urine samples. We all know as clinicians that methylmalonic acid is a more accurate test than even serum B12, a blood test. The urine of B12, the marker of a B12 metabolite, a byproduct of B12, if we measure that, if it's high or low, we know about vitamin B12 status. We can do that with many vitamins, and therefore we can mail out to you a simple urine test and know so much about your vitamins. And that same urine test can tell us byproducts of chemicals in the environment, how your mitochondria, your energy producer of your cell, how that is functioning through its energy cycle known as the Krebs cycle. If it's byproducts of that Krebs cycle can tell us so much about how the body is taking fat that you eat, and is it causing inflammation, and is it going through that cycle, the Krebs cycle, without so many byproducts. Similar when you're checking the exhaust of a car, you can see how the engine is burning gasoline by seeing the byproducts of the exhaust. We could do that with a urine test. So again, we're going to be there for you because that is our mission. Our mission started so many years ago, 20 years ago, with the immune system and inflammation. At that time it was HIV/AIDS, but it was such a learning experience to understand the immune system. And that 20 years ago when we started was a real special time. A special time where I was finishing my degree in nutrition way before I was a nurse practitioner and board certified holistic nurse practitioner. I had a degree in nutrition. And I was determined to educate groups of people, not just one person at a time. So I would do large demonstrations at food pantries, how to eat healthy. And that's where I met a good friend who, sad with quite sadness, passed today. Good friend, Chaim Reisner, who was there when I was educating people in Pittsburgh about eating healthy, about cooking with choosing sweet potatoes over potatoes. He was there for that demonstration. Choosing sardines over Spam. He was there for that also. It's been a long journey, but we're here for everyone today. This disease has humbled us, humbled all of us. And we've all realized that we're servants of our Creator to find our mission and to fulfill our mission. Everyone, have a great day, enjoyable evening. We'll talk to you soon. Take care.